It looks like here you have hip arthritis.
Hip arthritis or osteoarthritis is a very common joint disorder people suffer from. How many times have you been told you have arthritis and you're like, I don't really understand what that means? Well, in Latin, arthritis means pain in the joint. Arthro means joint, itis means inflammation.
The hip joint is called the femoral acetabular joint. The femur is part of the thigh bone and the acetabulum is part of the pelvis. It's a synovial joint that is shaped like a ball and socket. The femoral head and the acetabulum is lined with cartilage, which allows adaptation to load and stress, especially during gait. The cartilage also reduces friction in the joint, absorbs compressive forces, maintains joint height, which provides stability. Any dysfunction to the surrounding muscles and ligaments of the femoral acetabular joint can cause joint dysfunction, which can lead to joint degeneration. Here are some signs and symptoms of hip arthritis. Anterior hip or groin pain, which increases with daily activities, such as sitting, walking, and/or going up and down stairs. Buttock pain. I occasionally see patients with hip arthritis with buttock pain. This typically increases with prolonged sitting. Locking or sticking feeling in the joint. Limited range of motion. Joint stiffness, especially being in a prolonged position and getting out of it, but it feels better after moving around. There are 3 stages of hip arthritis. Early stage, thinning of the cartilage that can lead to joint instability, typically not noticeable or symptomatic. Intermediate stage, could be painful or painless. Possible fibrotic changes and scar tissues forming. Late or chronic stage, joint destruction has reached the bone region. Loose bodies such as osteophytes are present in the joint. Typically at this stage, the destruction is irreversible.
When you watch people walk, you might notice that not a lot of people walk with full hip extension. This deprives the hip joint of getting proper full nutrition.
Joint lubrication occurs with walking. Walking with a full stride and executing hip extension during toe-off provides nutrition to the micropores of the cartilage. Here are some treatment options for hip arthritis. Physical therapy. A physical therapist can help strengthen the muscles surrounding the hip joint. Aquatic therapy would be a great choice if you have a lot of pain with weight bearing. Weight reduction. 10 pounds of extra weight can add 60 pounds of pressure to the hip joint with each step. Proper shoe wear with good support. Assistive device. Walking and moving with a cane or walker can offload the hip joint. Surgery. Still see a physical therapist before surgery to better prepare your body.
Please see a physician or a physical therapist for further examination. My name is Michelle, your physical therapist. Until another session, guys. Bye!